My name is Phillippi. I am a pediatrician at Midtown Clinic. I became a pediatrician because when I was in med school, I found that I just loved working with children and their families. As a pediatrician, you really have an advocate in parents that you don't have when you're working with adults. Parents who will go to the moon and back for their kids, and it's an honor to work with them. So I worked with this group of pediatricians and with this community when this clinic was the Downtown Health Center as a resident, and I really enjoyed it. They were some of my favorite months of residency, getting to work with this patient population. So I'm really looking forward to working at Midtown with a group of great providers and getting to work with these kids and their families. I would say that from my time in residency, I could tell that the parents in this community really are working their hardest to provide for their kids, and it's kind of an honor to be a partner in that process. I really like getting to follow kids throughout time and see them, get better when they've been ill. Kids are really resilient, and kids also say really hilarious things, and I think that as a pediatrician working one-on-one with kids and their families, you get to kind of hear those things and see their joy even in the midst of illness, and that's really neat. So I would say one thing that's a bit unique about my training is that after I finished my pediatrics residency, I went and got my master's in public health. So I've worked with some of the providers in Milwaukee who do public health work, and I think I really take a community approach, and I'm really interested in connecting families with community resources, but also working with the community and developing partnerships to serve our patients. So having a background as a hospitalist, I think that what I will bring to being a primary care pediatrician is experience with sick kids and being able to differentiate when kids need to be in the hospital and what we can do for kids as an outpatient. I also think that what I bring is all those relationships from children's, having worked very closely with our specialists and knowing not only how the system works, but what kids experience when they're hospitalized and what families experience, so that I can partner better with our families and our inpatient doctors when children have to be hospitalized. What I would want a parent to know about me if they were choosing me as a pediatrician is that I have cared a lot about the kids that I've worked with, but I've also had kids in my life. My little brother is 12 and a half years younger than I am, and I don't have children of my own yet, but I understand what it's like to have a small child at home, and how delightful they are, but also how worrisome it is when they're sick or when you're worried. And that I am really honored to be a part of the partnership between a parent and a pediatrician in helping kids grow up healthy and strong and ready to lead adult lives.